Hello, my name is Ashley Baker, and today I'm going to be demonstrating how to perform a cleansing enema. So I did come in and introduce myself. My name is Ashley, and I'm going to be the student nurse today. I did make sure that my patient was alert and oriented, times 4 to person, place, time, and purpose. I did assess beforehand if she's had any recent surgeries, because the straining that may be caused during the enema could cause an increase in intracranial pressure, and we definitely don't want that. I did assess her abdomen and listen to her bowel sounds. I asked about her last bowel movement, what it looked like, was there any changes, any bleeding, anything like that. And the doctor is certain that she has a fecal impaction or is well on her way, so we are going to be giving the enema. I did check blood, creatinine, and her electrolyte levels, and I have assessed her sphincter tone, so she is good there, and I will not have to be holding the buttocks shut. So I have explained the purpose to her as well for the enema, what she can expect, and the enema solution, the cleansing solution, has already been warmed. It is 500 to 1,000 milliliters, and we definitely didn't warm it in the microwave. And it is 105 to 110 degrees. It's lukewarm. We don't want it too cold because that can cause severe cramping, and we don't want it too warm because that can cause like intestinal burns and that kind of stuff, and we definitely don't want that. So I am going to, my supplies are sitting over here beside me because Miss Allison has the tables with the arms for IVs on them. So I, of course, would never turn my back away from my things, and they would be right here beside me, but for demonstration purposes, they are sitting off over here. So I would already have my water in here, like I said, the 500 to 1,000 milliliters, but for demonstration purposes, I will not be actually putting the water in the bag because other students will have to use these too. So also, we only have one pair of gloves, so for demonstration purposes, I will just be stating when I would change my gloves. So I'm going to go ahead and apply my gloves. My patient is also not in any pain at the moment. She is pretty uncomfortable and ready to pass a bowel movement though, so hopefully we're gonna get her there. Okay, so I have my gloves applied. Again, these are not sterile gloves. I'm going to get my solution, and I'm just going to do it right here in front of you so you can see me. But of course, I would have my bedside table and never place my things on my patient. So here's my soap, because this is a cleansing enema. So it will contain the water and soap. So it's a soap suds one. So here's my tubing, and I would of course clamp. And then I would fill my 500 to 1,000 milliliters in here and hang it on my pole. And then now is when I would, just before then, when I would have put the soap in, I would have squeezed it like this. You never want to shake it up. You just squeeze it like this. And in the clinical setting, there would be a cap on this tube, and some are already lubricated, however some are not. So here I would pull my trash can over here. I would unclamp, and I would prime my tubing into the trash can. I would clamp again and recap. And now I'm going to set it out of the way while I position my patient. Like I said, I did already put the soap in, but for demonstration purposes, I didn't want to already use it so that the other students could as well. Going to set that out of the way. Here, I would change my gloves, and now I'm going to position my patient. So we are going to go ahead and get her to turn on her left side, which she is fully capable of doing, so I'm just going to assist her, and her side rail is up over there. Going on our left side, and we want our left leg straight and our right one bent. And she's gonna hold the side rail, and she can hold herself up. Okay, okay. There we go. Now, I'm going to place my protective barrier. Going to place my towel or my bath blanket. Of course, never shaking the linens, just want to give her some privacy. And going to place the bedpan under her. Oh, okay, don't run away. Let me see. We'll position the bedpan under her. And I have cleaned the area, so now I would change my gloves again, and now we're going to perform the enema. So, I have my tubing, and it is clamped. So there is some that are already lubricated. This one is already lubricated when I remove the cap, or it may require extra lubrication, which you can do as well. And I have already primed my tubing. My patient's perineal area is clean. So I am going to tell her that it's going to be some slight discomfort, but if she's in pain at any time, to please let me know. And then I would stop and pause for 15 to 30 seconds. And then if the pain continued, we would, of course, remove it and then call the physician. So I am going to go ahead and insert the enema, 7 to 10 centimeters. And then we're going to unclamp, monitoring my patient while the procedure is being performed, of course. And then here, once it starts, we do lower it to hip level. That way we're not instilling it too fast. Down at hip level, that way we're not instilling it too fast. And then we slowly raise it back up, slowly. And then we would reposition the pole. Oh, okay, my patient's kind of falling back a little bit. We would reposition the pole down. Okay, and then once the enema is done instilling, we would clamp it again. Then we're going to remove the tubing, and then here, if there was stool on the end of it, I would of course wrap it and discard in the biohazard bin. And I have informed my patient that I will be here for immediate assistance whenever she needs a bowel movement, whenever she feels like she's going to need a bowel movement. That's in the biohazard bin. There was no leakage, so I would just clean this and place it in the bathroom, never on my patient's bed. I am going to instruct her to hold it for 5 to 15 minutes. And since she's not incontinent, we're not going to leave the bedpan under her. So we're going to have her roll on back. And she's going to wait the 5 to 15 minutes. And then discarding the linens. I've given her her call light. I would remove my gloves and perform hand hygiene. Of course, every time I remove my gloves, I'll perform hand hygiene. And I have instructed her, as I just said, I will be here for immediate assistance. She just presses that call light and I'm on my way. So it has been the 5 to 15 minutes, and she has told me that she's ready to have her bowel movement. And of course, I would have the bedside commode or bedpan always readily available for her. So we're going to have her roll to her side and just use the bedpan for demonstration purposes. But if she was wanting to or was able to, we would take her to the bedside commode. So we are going to have her roll back on her left side. Okay. And then we would, of course, place the bedpan, give her some privacy, call light, and then we would come back. Now, we're going to assess her pain level whenever we come back in the room. She has called me back in here now. So I am going to look at the stool, examine for odor, any bleeding, consistency, amount, and then I'm going to give her perineal care. Of course, always wipe it and cleanest to dirtiest. Make sure she's good to go, assess her pain level, see if she's in any discomfort. Of course, I would clean this and take to the bathroom. Again, I would never leave it on my patient's bed. And I will record that on the graphic sheet. And she is clean. Gonna go ahead and have her lay on her back and get her in a comfortable position. Of course, I did change my gloves. Leave her with the call light. The bed is locked and in the lowest position. She only wants one of her side rails up. Discard my gloves and perform hand hygiene. And of course, I do see that I have left the protective barrier pad. So we are gonna have her roll over real quick and roll this out from under her feet. And of course, discard. And I would have put gloves on again for that. And remove my gloves and perform hand hygiene. Discard that in the biohazard bin. She is comfortable, and I will come back in 15 minutes to check on her, make sure everything is good, and let her know if she needs to have another bowel movement to please let me know. Remove my gloves and perform hand hygiene. Thank you.
You don't need to redo it.
Hold on, I can't get it to stop.